Let's discuss that with MS Now Capitol Hill reporter Kevin Fry, our reporter Maya Eaglin here in New York, and we're joined by MS Now political analyst, former Democratic Congresswoman Donna Edwards. Maya, starting with you, just lay out the scope of what we could see here when it comes to the monthly increases that people are going to see.
Yeah, this is going to impact a ton of people. I want to take a look at some of these numbers. The average premium, according to healthcare experts, could increase 114% after those failed extensions for those subsidies. Over 20 million people impacted. However, some states like Massachusetts, Oregon, and New Mexico provide state subsidies for low-income enrollees, and they're trying to close the gap there. If you zoom in on those 20 million people, though, it's usually people without employee-sponsored insurance, those who don't qualify for Medicaid or Medicare, and small business owners, entrepreneurs, farmers, folks with less resources are going to be hit hardest here.
Yeah. So, Kevin, before Congress recessed for the holidays, a handful of Republicans joined the Democrats to force a vote on extending the ACA subsidies. So what happens when they return next week?
Right. I mean, and remember, there was a lot of pressure points in December. There was this looming deadline. You saw an attempt by Republicans who kind of admitted they had to do something to get caught trying to put forward a bill, but it didn't address the expiring subsidies, that House bill. So while it passed the House, it's not going anywhere on the Senate side. And so you saw this handful of more moderate Republicans in these competitive congressional districts that, if they do not act, are more or less facing the chance of losing their seat in Congress, signing on to this discharge petition for a 3-year extension of those subsidies. Now, that's already failed in the Senate. It's not going to become law, but the hope is from some moderates, both on the Democrat and the Republican side of the aisle, is that this would force action in reaching a bipartisan compromise. So in terms of the timeline right now, we're looking at over the next 2 weeks, the House will vote on this 3-year extension bill. They'll send it over to the Senate side, where bipartisan negotiations have been ongoing, including, I'm told, over the holiday break. And then they will potentially put forward an alternative, maybe a 2-year extension, a 1-year extension of the subsidies with various reforms that might be more palatable to what Republicans have been demanding, like, for example, income caps. And then they could send that bill back over to the House for final passage and extend these subsidies in some form for a few years to address the health care costs. Of course, this involves a lot of ifs. Will the Senate be able to actually come to a deal? They have struggled to do so over the last several months. Will leadership of both houses, the Republican leaders, put those bills on the floor for consideration? They'll face a lot of pressure to do so from their moderates, but that's another open question.
Yeah, and another big variable, Kevin, is whether President Trump himself will get involved here. We know the president was pretty hands-off with ACA negotiations during the shutdown. Now that the price hikes are officially upon us and it's a midterm year, are GOP lawmakers going to demand that the White House step in here, bless some sort of plan?
I mean, look, they have been. If you talk to Republicans on the Hill, on the side, they will tell you, many of them, that they would like to see the president more directly hands-on in these negotiations, in no small part because it would basically force Republicans to move forward. Yes, there have been obviously some very notable breakings from Trump in recent weeks and months by Republicans, including prominent members of the MAGA movement. But the president still has a lot of sway on Capitol Hill. And so if he's able to put forward a proposal, that could move things along. Keep in mind, his idea, and he has repeatedly gone back to this, is essentially replacing the extended enhanced subsidies with HSA accounts, sending the money directly to consumers. That is an idea that Republicans have been working on, but it would be a much bigger lift than just a simple extension.
Yeah, that's something Bill Cassidy has been trying to push through. We don't know how much support there will be for that or whether it's logistically possible. But, Donna, Republicans, as Kevin alluded to, want to see those guardrails to protect against fraud. They want to see caps on credits to higher income earners. Some of them demand the Hyde Amendment, anti-abortion protections for any extension. We, of course, know that's a non-starter for Democrats. But what kind of compromises should Democrats take a look at to push through a fix in Congress?
Look, I think there is a sweet spot for a negotiation and for a compromise, and it is on the income caps for higher income earners. It's on putting some guardrails against fraud. So I do think that there is the ability to do that. But I think when the president stepped in back in December, he dipped his toe in offering a solution. He was rebuked by conservatives. And so he's going to have to really lean, I think, on Republican members. Otherwise, the Republican Party, Republicans across the country are going to face a real backlash by voters and consumers, because these healthcare spikes are really huge. And frankly, the HSA, the Health Savings Account program, really doesn't work, because the amount that's being proposed, about $1,000, doesn't really go to the costs, the high costs and increased costs of the premiums.
That's right. So, Maya, according to KFF, if ACA premiums double, 1 in 4 enrollees say that they're likely to just drop their insurance altogether. So speaking of voters, of Americans who are affected by this, what are they telling you?
They're at a crossroads, right? So many of them are having to make these really difficult decisions, some of them moving back home with other family members, others jumping off of healthcare completely and just hoping that they don't get sick. I want to play a conversation with a mother who was enrolled in ACA from Virginia. Her name is Kathleen Winters. She spoke to our colleague Ariel Hickson.
It could be anywhere from, $3,600 more for the year to almost $20,000 more for the year. And I'm not sure, or $20,000 total for the year. So I don't know even where we'll find the $300, if that's all it is. That's a really significant increase. It's almost double it. We pay $1,200 a month for preschool for my 4-year-old. I don't think most people have an extra $300 a month that they can easily absorb. It would frankly be catastrophic if it really is going to be $1,000 more a month.
So for folks who do get their health insurance from healthcare.gov, they have until January 15th when open enrollment ends. It's really important to check your new numbers and make your decision for your family there.
So if people do ditch their insurance, what kind of prices are they going to be dealing with when it comes to their health care, like medication?
Yeah, most medications are way more expensive without insurance, especially specialty drugs for cancer, HIV, autoimmune diseases. And so you can go with generic drugs from pharmacies. There's also companies like GoodRx, Amazon Pharmacy that offer subsidized and kind of lower costs. Another thing to check out is city and state programs that can also help families that are low income and in need of medical care or medication.
Really important advice there. And Donna, one of the main reasons for the ACA in the first place was reducing the number of uninsured Americans. Many Democrats saw Obamacare as the first step on the path towards universal health care, universal coverage. 15 years later, is that goal just totally politically out of reach?
Well, look, I think that, if we're going the direction that we're headed right now, with so many people making a decision that they're going to come off of an insurance program at all, that means that mostly a lot of young people are going to say, you know what, I'm going to take my chances and I'm not going to get health insurance. And what that means for the entire system is that the costs really go up because you don't have a whole bunch of healthy young people in the system. So this is a real disaster, and people going into emergency rooms because they don't have primary care. And so they're using emergency rooms, which are much more costly than just going to a physician. So all of the healthcare costs will be driven up if we don't resolve this problem.
Certainly ripple effects. I want to bring in now former Republican governor of Ohio, John Kasich. Governor, thanks for dealing with the perils of Zoom. We're glad to have you with us. According to KFF, good to be with you. According to KFF polling, 84% of ACA enrollees, including nearly all Democrats and 7 in 10 Republicans, say Congress should be extending these tax credits. The data was taken, of course, before these expired. But most enrollees say either President Trump or congressional Republicans deserve most of the blame here. So will health care be an Achilles heel for Republicans come the midterms?
I think it's a big issue for them. I've been saying it since they could not get the subsidy extension done. Maybe there's still a chance. Maybe there is an opportunity here in the next month or so. And part of it is going to depend, I think, Ariel, as to whether the media continues to focus on this and point out the hardship. Because the hardships are something that gets legislators' attention, and you're going to try to run for re-election. That's an issue. But secondly, it's a matter of the heart. You imagine if you didn't have any. Imagine if you didn't have any health insurance. What would you do? Now you'd go to the emergency room. That is, as Donna was saying, that's the worst way to get health care. So I'd say 2 things. One is, clearly, I believe that these things should be extended to people who are needy. They can make a compromise here about what the income levels are. And I've talked to members of Congress who are pushing for a compromise. But here's the fundamental issue. Can we at some point change the healthcare system to be one that treats people to keep them healthy rather than treating them when they're sick? And in order to do that, you need really significant leadership on both sides of the aisle. And what that means is that you have got to get doctors and hospitals, insurance companies, the pharma companies, lawyers in a room and come up with a program that bends the curve from the standpoint of I will give you an incentive to keep me healthy rather than treating me when I'm sick. In the meantime, those subsidies need to be extended because people are up against the wall. And it is just not right, and it needs to get done. And I give credit to a guy like Brian Fitzpatrick, a Republican from Philadelphia, who's been in the middle of this, and hopefully something can get done in the period of the next month or two.